Hi, this is Dr. Kavita Batula from Anu My Baby Hospital, Vijayawada. Here is a patient who had a second trimester miscarriage and later she had a DNC. On ultrasound, there were multiple fibroids, submucous, and also fundal intramural larger fibroid around 4 to 5 centimeter. She is planned for hysteroscopy, laparoscopic removal of fibroids. On entering the uterus from the internal os, we see several fibroids, submucous. One was on the anterior wall towards the left side, around 3 by 2 centimeters. It is kind of a type 0 fibroid. Another fibroid is on the posterior wall and towards the right side. It is around 2 centimeter. Another one is towards the lower portion of the uterus, around 1 to 2 centimeters, and another degenerated fibroid of around we can see at 4 centimeters degenerated area where the endometrium was absent. This is type 2 to 5 intramural fibroid. So, in these cases of multiple larger fibroids, the uterine cavity is enlarged. So, when we enter the uterine cavity, we have to look for the exact location of the fibroids, the size, and there may be multiple fibroids. So, each one we have to delineate, look for the ostia, and then see the internal os. And in respect with the internal os, we have to locate the fibroids. So here we can't see the right ostia, but left ostia was seen. So we had proceeded for the submucous fibroid resection. When we have to do resection of this submucous fibroids, larger fibroids are more complicated, but any fibroid which is extending into the intramural portion of the myometrium, we have to take care while resecting the base of the fibroid, as there'll be larger vessels of the myometrium. So we have to take care. When the fibroid is too deep, we may have to go for a second sitting of resection a few months later, so that the chances of having complication by fluid overload is reduced. We now see the fibroids being resected. Initially, the posterior wall fibroid, later, the anterior wall type 0 fibroid. The equipment we have used is minihysteroscope or mini resectoscope. It's a bipolar resectoscope of 18.5 French diameter. The distension media used is a saline. So we can use the mini resectoscope when the lesions are small, less than 2 centimeter. The advantage of this is that we don't need to dilate the cervix too much. Like 26 French is too big for resection. This can lead to damage to the cervix and later cervical incompetence. So, mini resectoscope is advantageous in this aspect. Please go on and watch the posterior and anterior, both submucous fibroids being resected. Thank you.